Welcome back, everyone. January 1st means a new beginning for many people, also means changes for your health insurance. Now, folks are hurrying to the pharmacy before ringing in the new year. Our Riley Livingston joins us live in the studio to explain why.
Joey, while most stores experience the holiday rush the days leading up to Christmas, for pharmacies the week before New Year's Day can be almost as hectic. With that turn of the calendar comes the double whammy of deductible rollovers and starting new insurance plans. Local pharmacies are gearing up for what they say is one of the busiest times of the year. Patients are flooding in to refill their prescriptions before the end of the year.
You have a lot of people that have met their deductibles on insurance, so it's always a good idea if you can get something filled before December 31st to come in and get it filled. That way the deductibles will apply in January versus the end of the year.
And while deductibles are drawing people in, the change of insurance will soon slow some of them down.
Some of the busiest and worst days in pharmacy are going to be the days after January 1. People's insurances will change at the first of the year. So if the insurance companies have not followed up, sent out the correct insurance cards, then the pharmacies won't, have those records.
Pharmacies are also facing another challenge, a lack of doctors during the holidays.
A lot of times just the doctor's office themselves being closed. This morning, for example, I was trying to get a refill for a patient. Their doctor's out till January 2nd. So my hands are tied, on that particular medication. Being a controlled substance, there's nothing we can do about that. Now, if it was a blood pressure medication, something routine, then, certainly we can loan them enough legally with state board to take care of things like that.
To help make your trip to the pharmacy a little smoother, often the best thing you can do is pick up your phone.
The easiest thing to do is call. Then we can at least make sure that their medications are ready. Another thing this time of year is you're having delivery issues because a lot of the delivery companies are not going to be running like they would throughout the rest of the year. If you call, then at least we can make arrangements. If we don't have it, then some pharmacies will let us borrow back and forth between each other.
Chris Bonner says another reason for the increase in business is the fact that Christmas fell at the beginning of the work week. Mondays are normally the busiest day of the week, and since many offices were closed Monday and Tuesday, that crams a week's worth of business into 3 days.